Hi, I'm Dr. John Chessare, the President and CEO of the GBMC healthcare system, and I'm here to give you our biweekly update on the coronavirus pandemic in the United States and also in Maryland and at GBMC. So you've seen in the news that we are seeing an uptick in cases, probably related to people turning indoors as the seasons change. It's a call to action for us to continue to wash our hands, to wear our masks, and to maintain social distancing. There are 471 people in Maryland hospitals today who are COVID-19 positive, which is up about 30 or 40 cases since last week. Interestingly, there are 103 patients in intensive care, again pointing out that the clinicians are doing a better job in treating patients with COVID-19 who are sick enough to make it to the hospital because fewer are requiring intensive care. So that is some good news. At GBMC today, we have 14 COVID-19 positive patients and only 3 in the intensive care unit requiring ventilation. So again, we are seeing a better picture of our ability to treat patients and keep them from making it to the intensive care unit. Let me say a word about immunizations. We believe that there will be the end of some of the clinical trials about immunizations probably by the end of November. If the data show that these vaccines are safe and reasonably effective, the scientist experts at the FDA will authorize the vaccines for use with the public. Once that happens, you will begin to see the immunization of first responders, emergency department personnel, and doctors, nurses, and other clinicians who are taking care of COVID-19 positive patients. That will be followed as soon as is reasonably possible because of the vaccine supply with the immunization of people at high risk, most notably elders. So stay tuned. We believe that a vaccine is on the way. It will take us a while before we can immunize enough of the citizens of the U.S. for us to start letting our guard down. In the interim, we must continue with our 3 steps of hand hygiene, social distancing, and mask wearing. I also would like to talk about the holiday season that is upon us. This weekend, there will be Halloween. We believe that very few children will be walking around doing trick-or-treating, but we are also concerned that families will want to substitute family gatherings and parties for trick-or-treating. A word of caution, again, if you come within 6 feet of a person who has COVID-19 but does not know it because they don't have symptoms yet, and you're within 6 feet of that person for 15 minutes or more, you are putting yourself at risk for getting COVID-19. So please, a word of caution about large gatherings, especially those that will be indoors. At the very least, make sure that everyone has a mask on, even if you know them, even if they are your family members, if they do not live in your dwelling. Also, make sure everyone washes their hands frequently. And if possible, if the space is big enough, try to get people to stay at least 6 feet away from each other. This will become an even bigger issue with the other holidays on the way, like Thanksgiving and Christmas. We should be very careful about indoor gatherings, even if we know and love the people. If we are going to get together, let's try to keep the numbers down. And again, let's try to keep people socially distanced and with their masks on. So as usual, I want to thank especially all the healthcare providers for standing up to the pandemic. And I want to thank all the citizens of Maryland for their excellent work in keeping themselves and others safe. If you need care at GBMC, you will be safe at GBMC. Please call your doctor or your provider if it isn't an emergency. If it's an emergency, call 911. We are here to serve you. Thank you, and I hope to see you in person soon.